Hi everyone, I am Dr. Mahalakshmi. I have done medical microbiology at University of Madras, Dr. ALM PG IBMS. I have been teaching the dental students for the past 3 decades. Today we shall discuss about sterilization and disinfection. And this is a very important topic for medical as well as paramedical group of students. And hope you all must be aware of this particular topic when we had a pandemic, COVID pandemic. How important is this sterilization? In fact, the lay persons are also now much aware of this particular protocol, sterilization protocols. So we'll see the different types of sterilization first. And before going into the details of sterilization, I would like to give a definition for sterilization and disinfection. Sterilization is an absolute term when compared to disinfection, whereas disinfection is a relative term. Sterilization is an absolute term. When we say any article is sterile, that denotes that particular article is completely devoid of all microorganisms, be it in a vegetative state or in spore state. Whereas disinfection, when we see, it's a relative term. Disinfection, the term itself tells you we are more bothered only about the pathogenic microorganisms. We want to get rid of the pathogenic microorganisms in the disinfection protocol. First, we'll discuss about the sterilization. Sterilization can be broadly categorized into 2 categories. One is physical method, another one is chemical method. Under the physical method, we have 3 types. One is heat, another one is by radiation, another one is filtration. While chemical method comes under disinfection protocol. So first we'll see what are the different types of heat methods of sterilization. So we have different physical agents under this. You have sunlight and drying. You all know the sunlight is an excellent source for sterilization. Of course, we cannot adopt this method for every articles, especially if we want to sterilize the mattresses in the hospitals or pillows in the hospitals. You can put it in the sunlight, and you know how it works also. The ultraviolet radiations from the sunlight helps us to completely destroy the microorganisms. They are bactericidal, in fact they are microbicidal, they destroy all the microorganisms. So sunlight is one source, but again this particular protocol we cannot adapt for everything. The next is the drying. Almost everybody knows that these microorganisms, out of 5%, 4% is made up of water molecules. So water is an essential factor for the survival of the bacteria. But the same microorganisms, when they are desiccated, when they are dried, easily they are destroyed. But again, this drying method is not a reliable method. We cannot adapt for any articles or any instruments or any media that we are going to sterilize in the hospitals. But we can definitely use it in certain areas. Next comes the heat. Heat can be again broadly classified into dry heat method and moist heat method. Dry heat method is completely absence of water here. Any instruments, any articles you want to sterilize by this method should be devoid of water molecules. The article should be dry. So under dry heat you have red heat method, flaming, incineration, hot air oven and microwave oven. So the red heat method is one of the dry heat method of sterilization, and this red heat usually we adopt for bacteriological wire loops. We just show these wire loops are either made up of nichrome or they are made up of platinum. And the property of this nichrome or platinum is they get heated up very fast and they also get cooled up very fast. So they are used for inoculating the cultures, bacterial cultures or any clinical specimen. These bacteriological wire loops are used, and before you use these wire loops and after you use this wire loop, both the times we are supposed to sterilize these wire loops by showing it in the Bunsen burner, by showing it in the flame till the wire loop turns red hot. Then it also cools very fast. So this is one dry heat method, and this definitely any laboratories, bacteriological laboratories definitely will adopt this method of dry heat sterilization. The next coming to flaming. Flaming is another important method of dry heat. Of course, this flaming method can be used for any materials or any metals made up of stainless steel or iron or everything. You can just show this in the flame for a few seconds. Again, it is not an absolute method of sterilization. We just show it for few seconds any microorganisms, especially when you are performing an antibiotic susceptibility testing, we place the disc with the help of the forceps. So after placing the discs on the media, these tip of the forceps should be shown on the flame. So this is another method of dry heat sterilization. The next one is incineration, which is an excellent method, very good method, incineration. It's a very safely you can destroy the materials, mostly incineration. What is incineration is? Incineration is completely burning to ashes, which is an excellent method. Again, you can't adopt this procedure for all the articles because some of the articles we are going to reuse it. So where you can apply this incineration is when you want to safely destroy the materials like contaminated cloths. Supposing a tuberculosis patient is admitted in a hospital and that patient is heavily contaminated these mattresses or pillow covers with the sputum which is loaded with plenty of microorganisms. So, and you don't want to reuse that material. So it can't be thrown away in the dustbin just like that. You have to sterilize it, or you have to dispose it, or you have to incinerate it. Very, very important, you have to incinerate it. And similarly, the animal carcasses. So animals are used for research purposes. We use many animals for research like mice, guinea pigs, and these animals after using for your study, even though they are live, you have to sacrifice the animal. We always use the term sacrifice, meaning killing the animals. We never mention it as killing the animals. We'll sacrifice the animals. The sacrificed animals should be incinerated. Animal carcasses should be incinerated. Similarly, the pathological materials, of course, in histopathology laboratories, we receive plenty of biopsy specimens. And these biopsy specimens, after reporting, will be stored in the laboratory for 5 years. And after 5 years, they are to discard this. Again, discarding, they can't throw it in the dustbin. It has to be incinerated. So this is an excellent method, incineration. Of course, you can't follow for articles which are reusable. The next one is hot air oven. Hot air oven is actually an instrument used for dry heat sterilization. And this hot air oven is actually kills the microorganism by oxidation effects. Why it is referred as hot air oven? Usually in this instrument, either on the side of the instrument or on the top of the instrument, there will be an opening. This opening should be kept open, it should not be closed, for the air to freely circulate inside the instrument. The air that circulates inside the instrument gets heated up. We have a thermostat and that gets heated up, and also the filament we have, heating filament, and that gets heated up. And this hot air only is going to sterilize all the articles which are placed inside this instrument. Actually, earlier book states the holding time and the temperature for complete sterilization of the articles that are placed in the hot air oven is mainly 160 degrees centigrade for 1 hour, which is desirable to destroy both the vegetative organisms as well as the spores. And this particular hot air oven, it is actually used for sterilization of glasswares, fine sharp instruments which are used in the surgeries, and powders, oil, greasy material, all these are sterilized using hot air oven. And this oven, when you are placing any articles to be sterilized, like especially the fine sharp instruments, should be completely devoid of water molecules. It should be dry and it should be wrapped. You have to wrap it completely. Any instruments that you want to sterilize, or even glassware has to be completely wrapped it, and you can even label what material is being kept inside the wrapping, because supposing you don't know what is kept inside, you will be opening the wrap and it will go waste. You have to re-sterilize it again. So labeling is also very, very important. So these instruments which you prepare for sterilization in an hot air oven should be kept on the perforated trays. Actually, hot air oven has 3 or 4 rack shelves, and each shelf has got a perforated tray. On the tray, you are supposed to place all the articles which are kept for sterilization, and this perforation is mainly for the free air to circulate. Very, very important note here, you should never jam pack these instruments. When you jam pack it, there won't be any free circulation of air. So that has to be noted. And currently the protocols have been little changed. The holding time, especially with respect to holding time and temperature, now they state that 160 degrees centigrade temperature when you are using, it has to be kept for 2 hours. And if you are leaving at 170 degrees centigrade, you have to keep for 1 hour. or if it is 180 degrees centigrade, it has to be kept for only 30 minutes. You should never exceed 30 minutes. The reason is, especially you are sterilizing the glassware which is plugged with the cotton. So these cotton can get charred at that temperature at 180 degrees centigrade, and no point in sterilization. Again, the article will go waste, you have to re-sterilize it. So the temperature should never exceed 180, and if it is 180, you are supposed to leave all the instruments only for 30 minutes. And this temperature in the instrument is actually controlled by the thermostat. So once you switch on, it is electrically operated after placing all the instruments which are necessary to be sterilized inside the hot air oven. Always it is made up of, the hot air oven are made up of gunmetal. It is made up of double lining, and when you close the door of the hot air oven, after switching on the electricity, you see the monitor the temperature. Actually, there will be a built-in thermometers in some of the instruments. In some of the instruments, there will be a perforation where you can place your own thermometers to monitor the temperature. And after it reaches your required temperature, that is 160 or 170 or 180, whichever temperature you need, after it reaches the required temperature, you have to control the thermostat, and you have to note down the timing only at that time after it reaches. So in the sense, all the articles inside the instrument should be exposed at that temperature 160 for 1 hour. It is not the timing from the time when you switched on the instrument. It is the time when the temperature required is reached. So you are supposed to keep it for 2 hours or 1 hour depending on the temperature. Then after the protocol finishes, you switch off the instrument, and immediately you are not supposed to open the instrument. The reason is very high temperature inside the instrument when compared to the room temperature. So if the glassware can break if you open it with the difference of temperature and pressure. So after the temperature comes down to room temperature, after it reaches the room temperature, then you can open it, remove all the articles, and you immediately label it that it is sterile. That's very, very important, so that it can be stored for usage. Otherwise, if you don't label it, you won't know whether it is a sterile articles or unsterile articles. Okay, fine, you have done all the sterilization using this instrument, but how far you will know that instrument is efficiently sterilized? Because very important, the surgical instruments are also you are sterilizing inside this instrument. So you are going to the surgeon is going to perform the surgery, and if that instruments you should ensure whether it is 100% sterilization has been achieved. Very, very important. So for that purpose, we have controls, sterility controls. There are 3 types of sterility controls. You have physical control, chemical control, and biological control. Physical control, you have thermocouples which can be attached to this instrument, and then and there at the same time you can monitor whether the thermocouples can be attached to different compartments, lower compartment, middle compartment, and upper compartment. And you can monitor the temperature then and there with the help of a potentiometer. And this is one way of observing the temperature, whether it has achieved, required temperature has been achieved. The next one is chemical control. In the chemical control, we have 2 methods. One is Brown's tube, another one is Bowie's dictate. In Brown's tube, you have a solution in that tube which is red colored. Supposing if you, these Brown's tube also has to be, some of the tubes has to be placed in the bottom and some in the middle and some in the upper compartment. And this Brown's tube, if it has been exposed to the same temperature, required temperature, the red color will turn to be green. So if you observe green, you are 100% sure your sterilization protocol is pakka. So that is one control. The next control is biological control. So as the name says, biological control, we are utilizing here the spores of certain organisms, especially if it's an hot air oven. We use the spores of Bacillus subtilis subspecies Niger. This spores will be impregnated in the filter papers, and these filter paper strips can be placed in the different compartments. And after you perform the protocol, you remove these strips, and you have to inoculate the strips, place the strips in trypticase soya broth, and you wait for 5 days, 3 to 5 days, and see if there is any growth in the medium. If you find any growth, your protocol is not proper. You have to find out what is the problem with the instrument, and you have to re-sterilize it. Supposing you find no growth, then it denotes your protocol is efficient and you have efficiently sterilized all the instruments using hot air oven. So among the 3 controls which we discussed now, The best one is the biological control. Why? Because our aim is to destroy the vegetative organisms as well as the spores, and here you are monitoring directly whether the spores are destroyed by cultivating these in a susceptible media. Okay. So, this is regarding the dry heat sterilization. The next one is microwave oven. Now recently people are interested with this, even dentists mainly they are interested with this microwave oven sterilization. Of course, it is not a very efficient method, and still it has not been approved by WHO. So only CDC or WHO, if they approve, we can utilize that for routine sterilization protocol, but still it is a dry heat method of sterilization. So now we will move on to moist heat method of sterilization. So moist heat method of sterilization, definitely there should be water. It is a moist heat. There should be, this is performed with the presence of water. So you can actually categorize this moist heat into different category based on the temperature. So you have methods which are temperature below 100, methods temperature at 100 and temperature above 100. So different methods under below 100. You have one method which is introduced by Louis Pasteur. We refer this method of sterilization as pasteurization. And we have two methods which has been routinely followed, but now recently one more method has been introduced here. So the routinely followed method is you have Holder method or flash method. So Holder method, we place whichever media, whichever liquid substance has to be sterilized, we place it at 63 degrees centigrade for 30 minutes. Whereas flash method, as the name says, flash method, the timing is reduced, we are increasing the temperature. In the flash method, the temperature is 72 degrees centigrade and this is kept for actually 20 seconds, 15 to 20 seconds. Nowadays, the pasteurization protocol, you all know, it is followed mainly in the dairy industry. And now these dairy industries, instead of following Holder and flash method, they follow another method referred as high ultra temperature sterilization or flash pasteurization or high temperature short term pasteurization. Here in this method, they increase the temperature, very high temperatures, even more than the autoclave. Imagine 140 degrees centigrade to 150 degrees centigrade, and it is kept only a fraction of seconds, 1 to 3 seconds, it will be exposed. And this pasteurization is mainly to destroy the milk-borne pathogens, mainly, especially your Mycobacterium bovis, your Coxiella burnetii, which causes Q fever, and Salmonella typhi. Of course, this Coxiella, Mycobacterium bovis, Brucella. Brucella is also another organism which can be transmitted through milk, which causes milk-borne disease. Of course, these three are milk-borne disease. But one more organism also I am referring here, that is Salmonella, which causes typhoid. Salmonella is not a zoonotic disease, it is not transmitted through milk, but still adulteration can occur. They may add water. So water will definitely contain these organisms if it is contaminated. So that is the reason why it can also be transmitted through milk. But among these four, the organism which can escape pasteurization, even this high temperature pasteurization, is this Coxiella burnetii, which causes Q fever. That can so as a dental students, I can refer this also an important question for NEET exam. So they ask this, which organism escape this pasteurization, that is Coxiella burnetii. So the other one is inspissator. Inspissator is one instrument, it's more like a water bath. Inspissator is a water bath, and especially certain media which contains serum or protein, like for example you have low flow serum slope which is used for cultivating Corynebacterium diphtheriae, or Lowenstein's Jensen medium which contains coagulated Ehan's egg. So these two media you can autoclave it. So for those media we use this inspissator which is exposed at 80 to 85 degrees centigrade, that is kept for half an hour. So to ensure more sterilization, you can even keep it for more than a day. Today you have kept for half an hour, again the second day also you can adopt the same protocol. And this inspissator helps to mainly sterilize the media which contains the proteins which are degraded when you apply more than 100 degree. So another one is vaccine bath. Of course, this vaccine bath is mainly used for sterilization of non-sporing aerobic bacteria. Non-sporing aerobic bacteria, if you are preparing vaccines for these bacteria, usually we keep it at 56 degrees centigrade for 1 hour, and it can be done for several successive, the term successive I am mentioning here. Today you do it, again you have to follow for successively for 3 or 4 days, tomorrow, day after. You can't break. If you break, then again there is a possibility for contamination. So this sterilization also has to be done for several successive days to completely devoid of any contaminations in these vaccines. So these are the different methods that come under temperature below 100 degree centigrade. Now coming to temperature at 100 degree centigrade, boiling is an excellent method. Of course, earlier we never had disposable syringes. Take for example 30 to 40 years back, we were using glass syringes, and the needles and the glass syringes were sterilized by boiling. We didn't even have autoclaves. Much of the hospitals and labs will not have autoclave facility. So they will use boiling method for sterilizing this glass syringes and the needles. But of course nowadays we don't use it. We all have disposable syringes available. So not necessary for this method for sterilizing the articles. And of course this method can be adopted in restaurants or in hospitals, especially you want to clean the utensils used by a patient. You want to completely decontaminate it. So for those protocols you can use this method of boiling. The next one is steaming, which is referred as Koch steaming or Arnold's steamer. The steaming is the same with the autoclave itself you can perform, or with a pressure cooker you can perform this method of sterilization. What you can do is you should keep the outlet open. If you are using an autoclave or in a pressure cooker, don't place the weight in if you are using the pressure cooker, and don't close the outlet if you are using an autoclave. Let the steam escape. When the steam keeps on escaping, the temperature that is maintained in an autoclave or a pressure cooker is 100 degrees centigrade. So at that temperature, you can usually, this method of sterilization is used for sugar media. Sugar media you cannot use autoclave. So for such substances which can be degraded by high temperature, the steaming protocol can be used. The next one is Tyndallization, which was introduced by John Tyndall. This is also at 100 degrees centigrade. And this is an excellent method for sterilization of sugar media itself. Mainly, we also refer this Tyndallization as intermittent sterilization. It is also referred as intermittent sterilization. At 100 degrees centigrade, it is kept for 20 minutes. Any media which you prepare, sugar media, you leave it in the autoclave with the outlet open, or in a pressure cooker with the outlet open. You place all the sugar media inside, and you either operate it electrically or on a gas stove. And once the 100 degrees centigrade, the steam keeps escaping. You leave it at that 100 degrees centigrade for 20 minutes. And this protocol has to be done for 3 successive days. That is the protocol of Tyndallization. You have to do this for 3 successive days. So why you have to follow this protocol? The day 1, all the vegetative organisms will be destroyed. And you all know some of the spores can withstand 100 degrees. Spores can even withstand 100 degrees centigrade. So what you do after sterilization on the first day, you remove the media, incubate it at 37 degrees centigrade. And incubate it at 37 degrees centigrade overnight, and after overnight 18 to 24 hours, you remove it. Again the second day you have to adopt the same protocol. You have to sterilize it at 100 degree for 20 minutes. Second day also you remove it. After sterilization, after cooling, you place it in the incubator. The second day of incubating is mainly some of the spores. Actually the spores will take 24 hours for germination, and some will take 48 hours for germination. So why you are doing for the second day also incubation is, any spores which do not germinate at 24 hours, they may take 48. For that purpose you are placing it in the incubator, and the third day again you repeat the protocol. You do the sterilization at 100 degrees centigrade for 20 minutes. So this is done on 3 successive days. So this is actually the best method for especially sterilizing the sugar media, which was introduced by John Tyndall. The next method is temperature above 100. It's an excellent method. The method that comes under this is autoclave, which is a gold standard method of sterilization. When it was introduced long back, it was introduced in 1890s, but still, even today, no other instruments has replaced this autoclave. It's a gold standard method for sterilization. It's an excellent method. And main difference, if you see, for dry heat and moist heat, in case of dry heat, I'll explain that after finishing this autoclave. Then you will be able to understand very clearly. So autoclave, again, like hot air oven, it's an instrument where moist heat method of sterilization is followed here in autoclave. Again, the organisms by autoclave are killed by oxidation effects as well as by coagulation of proteins. And here it uses moist heat to sterilize the articles. So how does it sterilize the article? So the autoclave and pressure cooker, which we use at home to cook rice and other articles, the food materials, they work with the same principle. So in a small laboratory setups, in a dental clinics, if you don't have a space to place an autoclave, it's best also to have a pressure cooker. So, but all the instruments, especially that you use in a dentistry, especially the critical instruments, as well as the surgical, for surgery also use this fine sharp instruments, everything has to be properly sterilized. So best way of sterilization is using an autoclave or a pressure cooker. So usually the principle, let me first explain the principle of this autoclave. When water boils in a vessel which is kept open, it boils when the vapor pressure is equivalent to the atmospheric pressure, and the temperature achieved at that pressure is 100 degrees centigrade. But the same water, when it is boiled in a tightly closed container where there is no escape of steam, so water boils at much higher temperatures. So you achieve more than 100, that is 120, more than 120 degrees centigrade is achieved in an autoclave or a pressure cooker. So the holding time and temperature to destroy even the spores, vegetative organisms as well as the spores, is 121 degrees centigrade for 15 minutes to 20 minutes is desirable when you place it in an autoclave. And you also have a thermostat controlling the temperature here. Again, it is a double walled insulation and it is made up of gunmetal like your hot air oven. It's a double wall. Mainly why you have a double wall insulation in a hot air oven or in an autoclave is so that the heat doesn't escape out. Okay, so the required temperature is maintained properly and accurately in the instrument. So it conserves the energy and keeps the heat inside and conserves the energy. That is the main reason why you have the double insulation. So any article, see here you have autoclaves are wide varieties. You have mini autoclaves in a small laboratories or small hospitals. They have a mini autoclave. In huge hospitals like CMC and 200 and 300 bedded hospitals, you see, you have a very big, huge hall, sterilization hall, where they have either a vertical type autoclaves or horizontal type, huge ones. You can at a time you can sterilize plenty of articles in these autoclaves. So there are different varieties of autoclaves, and whatever it may be, we always place the water level above the heating filament. So the heating filament is nothing but at homes you may be using the immersion heater, the same filament only, it's fixed in the instrument. So at least 1 or 2 inches above the filament the water level should be kept, and the instruments are placed on a drum. Actually in the autoclave there is an aluminum drum made of perforations, like how you had perforated trays in the hot air oven. Here you have a perforated drum. So it has all the articles which you want to sterilize has to be placed inside, and mostly I'll just tell you what are the articles we can sterilize inside the autoclave. You can sterilize all fine sharp instruments like how you sterilized in hot air oven. Everything should be wrapped. Here the wrapping can be either made up of craft paper or gauze cloth, or you can use ordinary newspaper, whatever it is. After sterilization, you have one more step here in autoclave when you are using a moist heat, because all instruments will be wet, whichever you are sterilizing inside, because the steam that is developed after heating, that will go condense on the articles, and the condensed steam will generate heat. That heat which is generated by the condensed steam only is going to sterilize all the articles kept inside the autoclave. So you have to be very cautious after removing any articles from the autoclave. That has to be kept for drying. There should not be any moisture. You know, moisture is a very important essential factor for the organism's growth. So if you leave it just like that, again it is going to get contaminated. So to avoid that, it has to be dried in the hot air oven. You have to place it at 80 to 100 degrees centigrade. You have to set up and you dry it, and after drying you can store it, and you can label it also that it is sterile, and you can use this. So as I told you, the metal instruments, everything can be sterilized by autoclave, and also all media that you are using for cultivating the bacteria cultures can be sterilized by autoclave, like liquid media, solid media, any media can be sterilized by this autoclave. So it is an excellent method. Wherever you can adopt this particular method, please go for this method of sterilization instead of using a dry heat. So fine sharp instruments, you can best go for a autoclave instead of hot air oven. When this is not possible, even hot air oven is good, but the temperature you have to increase it. So here again, how far you are sure after sterilization, all the articles which you have placed is 100% sterile. Again here we need to have controls, the same control only. You have physical control, chemical control and biological. Physical is again thermocouples which is attached to a potentiometer. You can monitor the temperature then and there by placing it in the bottom, middle and in the upper compartment. A chemical control, you have a Brown's tube which has a red colored solution which will turn green when it is exposed to I told you the holding time and temperature 121 degrees centigrade for 15 to 20 minutes. So if that articles are exposed at that temperature for 15 to 20 minutes, the red colored solution will turn to green. Then we are sure definitely the sterilization is proper. Now one more thing I forgot to mention during the dry heat sterilization. So that is Bowie's Dick tape. It is nothing but a small tape which will be very, it will be a white based tape actually. So that tape is placed, white colored tape which is placed in the different compartments. If the required temperature has been achieved either in a hot air oven or in an autoclave, there will be diagonal lines that is developed on the tape. The tape is just a plain tape, but after the sterilization you see a small diagonal lines on the tape, and that ensures your sterilization is proper. And the next one is biological control. Like in hot air oven you used the spores of Bacillus subtilis, but here we are using for moist heat the spores of Geobacillus stereothermophilus, which is earlier referred as Bacillus stereothermophilus. Now the generic name is changed. It is Geobacillus stereothermophilus. The spores of this organism are impregnated in the filter papers, and these filter papers are placed in the different compartments, and after sterilization you remove it and place it in the triplicase soya broth and see if there is any growth. You can place it for 3 to 5 days in the incubator and look for any contamination grown. If you don't find any growth, then your sterilization protocol is proper. Fine. This is regarding the moist heat method of sterilization. Now we'll see the difference between hot air oven and autoclave. Hot air oven is a dry heat method. Autoclave is a moist heat method of sterilization. The vast difference, if you see, the temperature is less in autoclave, but efficiently it destroys also the spores. Whereas in hot air oven, the temperature is high, 160, 170 or 180. And timing also, you see, you are supposed to keep it for 1 hour or 2 hours or 30 minutes when you are increasing the temperature. But here in autoclave, you are keeping it at 160. The temperature also is less, timing also is less, but efficiency, if you see, almost equal. This also excellently destroys the spores. The difference between the dry heat and moist heat is the penetration power of moist heat is very, very high when compared to dry heat. That is why moist heat is the best method for sterilization. Wherever you can't adopt this method, then you go for a dry heat method of sterilization. So gold standard method of sterilization is autoclave. And similarly, boiling, we saw it is one of the method. So when you see boiling, so you go to a restaurant, when you have a South Indian restaurant, you are having any idli or dosa at South India restaurant, safe to use sambar than to have chutney. Of course, they are not going to boil the chutney, but sambar is a boiled product. Completely, it will be devoid of all microorganisms, very safe to use. Next, we will go to sterilization by filtration technique. So filtration mainly helps to remove the bacteria from any liquid. See, actually liquids can be sterilized by autoclave, but certain liquids like serum and liquids which have sugar in it, or which liquids which have antibiotics, for parenteral use, any drugs which cannot be exposed to heat, you cannot expose, but at the same time these products should be sterile. Then what method you can adopt? So best way is to use filtration techniques, which helps to remove the bacteria from the heat labile liquids. So we have different types of filters. You have candle filters, asbestos filters, glass sintered filters, membrane filters, and you can also filter the air, especially with the type of filter called HEPA filters, which is referred as high efficiency particulate air filters. So we will see each and every type of filter, the properties and how it is used. The candle filters, I think all must be aware of these candle filters. Some 20-25 years back, even at homes we used to have this filter. The two stainless steel containers, the bottom container will collect the water, the top container will have these candles which is fixed, which is made up of diatomaceous earth, and you pour the water which is very turbid onto the first top compartment. And this may take few hours, say after 5 or 6 hours you can observe the water which is crystal clear collected at the bottom compartment. So this was used some 20-25 years back. Nowadays I don't think it's available in the market, and this is an excellent filter only for clearing the turbidity. It doesn't filter the bacteria or viruses. You want to clear the turbidity, water turbidity, sand particles, mud particles, or any other particles present in the water, that can be cleared excellently with this diatomaceous earthen filters, which is actually referred as Berkfield filter. The other one of this same candle filter is Chamberlain filter, which is actually made up of unglazed ceramic. They are made up of ceramic filters, and these two types, both the ceramic type as well as diatomaceous earth, they are efficient in only clearing the turbidity. They don't filter the bacteria or viruses. Even though different porosity is available, but still it is used only to clear the turbidity. This is regarding the candle filters. The next one is the glass sintered filters. The glass sintered filters are actually the same as that of candle filters, but only thing is it is made up of fusing the finely grinded powdered glass particles. And again you have a graded porosity, but still the grades are little higher, which cannot filter the bacteria or viruses. So mainly these glass sintered filters, pretty expensive they are, but still it is used only to clear the turbidity. But one thing is, Chamberlain filters, the candle filters are little difficult to clean. It's little difficult, but these filters are very easily you can clean them, but very brittle, highly expensive when compared to even the candle filters. But both are used only to clear the turbidity, candle filters as well as glass sintered filters. The next one is the asbestos filter. So the asbestos filter is referred as Seeds filter. So this asbestos filter is actually made up of asbestos pad, and it's a little thicker, and if you want to sterilize it with the asbestos pad, that pad should be first of all sterile. So what we do, we place this pad in a Seeds filter, which is nothing but a U2 unit. You can screw it, you remove it, you place the asbestos filter, again you screw it back, and this should be completely wrapped with the gauze cloth, and you autoclave it, you dry it, and now it is ready for filtration. So here in this Seeds filter, either you have to apply a positive pressure or a negative pressure. So I will just give you an example for a positive pressure and negative pressure. Supposing you want to take blood from a patient. You want, for any blood test you want to do, you want to check a sugar level, you want to collect the blood. What method you use is you suction, a negative pressure. But you want to give, supposing you want to give an injection to a patient. Okay, you will push the parenteral material into the intramuscular or intravenous, whatever route you may use, you will be pushing it. That is positive pressure. So here again, you can either use a positive pressure or a negative pressure, and you can filter the fluids. And in this Seeds filter, large amounts of fluid can be filtered. One thing, you have an advantage of filtering a large amount of fluid. There is a disadvantage with this same filters. One is it can filter only bacteria, not viruses. The porosity is such that it can retain only the bacteria and the filters, not the viruses. Viruses escape the filters. Another thing is the asbestos pad are carcinogenic. That is one disadvantage. Another disadvantage is in these asbestos pad, actually the material that you filter, some of the material gets absorbed by the disc, asbestos disc or filter. So supposing if the material you are going to filter is pretty expensive and the amount also you are going to filter is very less, say for example you are filtering 10 ml, you may even lose 2 ml of the material which will be absorbed by the asbestos. That's the biggest disadvantage with this type of filters. Next, we will see about the membrane filters. The membrane filters are either made up of cellulose esters or other types of polymers. And the main applications of these membrane filters, they are used for water purification and water analysis. You want to do a water analysis. Take for example, you want to check your water of your metro water, or from your sump you are collecting water, or from your well you are collecting, or from a pond. So you want to check whether there is any contamination. So of course you have to collect some 1 or 2 liters. What you do, you have to filter it, and that filter is used for inoculating on the media. So the filter will hold all the microorganisms and you can inoculate it on the media. So mainly these membrane filters are used for water purification and analysis, and also for sterility and sterility testing. And especially any solutions which are used for parenteral use, for antibiotics or any drugs. So that could be that where you cannot apply heat. So those solutions should be filtered with the membrane filters. And here you have a wide range of pore diameters. So you can always compare these membrane filters with the asbestos filters. So asbestos filter add a disadvantage, it cannot filter the viruses, but membrane filters has different graded porosity where even it can filter the viruses. And similarly the absorption we saw, there a large amount of fluids are absorbed, but in membrane filters they are very thin, only small quantity will be lost in this membrane filter. So because of wide range of pore diameters, this membrane filters are available. And here also, like how you had in a unit in seeds filter where you place the asbestos pad, here also you have syringes or small molds made up of plastics, that in that holders you will have to place these sterile membrane filters. Already the filters which are supplied by the manufacturers itself, they sterilize and they supply. So you have to place it in this, and these holders may be unsterile. So that's why you need to go for one more sterilization protocol when you are using these. Or you can actually sterilize it before you place the membrane filters. And when you are placing the membrane filters, it has to be done in sterile precautions. You have to perform it in a laminar airflow near the burner. You place this so that completely the protocol will be performed in a sterile atmosphere. So this is regarding the membrane filters, and now we will pass on. But one particular note I wanted to mention about the autoclave, which I described earlier. Before you perform any protocol, the opening I said should be open for few minutes. That is mainly for air discharge, is very important for autoclave or even a pressure cooker when you are using. Why it is important? 3 important points you please do, you can note down. So one is the air is denser than the steam. So when the air gets mixed up with the steam, your required temperature of 121 will not be achieved. That is one reason. Another thing, air being denser than the steam, it will go and occupy the bottom area of your autoclave, and so any articles which is present in the bottom area will not be sterilized properly. And another thing is, when air is mixed with the steam, the penetration is affected. We say always the moist heat, the steam is highly penetrative. That is hindered when air is present. So very important. So approximately you can keep it for 5 to 10 minutes. After you switch on, you just see if there is hot steam escaping, then you can close the outlet. So that is mainly for discharging the air. That's a very important point you should note down for an autoclave. And before finishing, I would just like to recall the important points which we discussed earlier, right from the moist heat and the dry heat. So moist heat method of sterilization, what are the methods? You have red heat, flaming, incineration, outer oven. And in moist heat, you had temperatures below 100. At temperature below 100, you had pasteurization, vaccine bath, and you have inspissator. At temperature 100, boiling and steaming and tenderization. Temperature above 100 is your autoclave. And coming to the methods of filtration, you had candle filters, you had glass sintered filters, you had asbestos and membrane filters. Among the various types, the excellent ones are the membrane filters. And one more is the HEPA filters, where the air can be filtered with the HEPA filters. Usually the HEPA filters are attached to the laminar airflow. We will now conclude with this lecture, and in my next video we will discuss about the radiation methods and disinfection methods. Thank you for listening.